Hi, and welcome to Florida Hospital's Health Chat. I'm Jennifer Roberts. Once a month, we pick a topic to provide a Florida hospital expert so you can get your health questions answered. We have our conversations, they're no more than 30 minutes, and we try to have them over the lunch hour so you can take a little break from work and get some health information that you might need. Today's topic is one that many ladies can probably relate to. We're talking about how to get your bladder back to business. Our expert today is Dr. Jessica Faranek. She's a Florida Hospital GYN surgeon. I've got a few questions to get things started, but this really all works best if we get questions from you. So we'd love to have you submit your questions at the bottom of the video there. You can type those in, or if you have social media on Florida Hospital's social channels, we'll take your questions there as well. Just submit it during the chat forum there at the bottom of the screen. Dr. Faranek is in, so let's get things started. Welcome, Dr. Faranek.
Thank you so much for having me.
All right, this is a topic that a lot of women don't like to talk about, although we're starting to see more people talk about women and incontinence and things like that. But this is something a lot of women don't even mention to their primary care doctors.
And you're right. Actually, about half of women don't even mention the problem to their doctors, and lots of women have this issue. The issue increases as we age. It starts out about 7% in women even as young as 20 to 40, and then it can increase to about 30% by the time we're 80. So there's a very prevalent problem that needs to be addressed.
Yeah. When we hear urinary incontinence, a lot of people think it just happens to older women. Is that the case?
No, no. In fact, 20 to 40-year-olds have about a 7% risk of incontinence. So if you think about it, 1 in 10 women after a childbirth episode may have incontinence that needs to be addressed.
Mm-hmm. And you know, it can happen at any age. It is common though in women after you've had a child.
It is common in women after a child. 20 to 40 have 7%, 40 to 60 have about 14%, 60 to 80 have even more, almost 25%, and then over 80 about 30 to even 50% if you're in a nursing home.
Wow. Talk about the childbirth piece of that. And I know I have friends that you know had vaginal births and you know talk about that issue a lot. Is it more common with a vaginal birth?
It is more common with even pregnancy in general. We think that the weight of the pregnancy does do something to the pelvic floor. And then certainly if you have a traumatic vaginal delivery with an episiotomy or with forceps or a vacuum delivery, then you will traumatize the pelvic organs a little bit more. And pregnant women themselves are usually incontinent, quite a large proportion of them. That will go away in the 6 months postpartum unless you've had a big injury. And you may be continent for those years afterwards, and then as we age and the tissues thin a little or is not as strong, then the incontinence will show up. But I do see young women with the problem.
And let's talk about what it is to begin with. I mean, what are common signs that, you know, people need to look out for to say this may be an incontinence issue?
Well, in the younger groups, it's actually more a stress incontinence, which is when you cough, sneeze, lean over, bear down, or even with intercourse. And then as we age, it changes more to an urge incontinence where you get the sensation to go and you just don't have enough lead time to get to the bathroom. So you start to dribble when you're unbuttoning your pants, or you'll have a full accident where you'll wet everything on the way to the bathroom. So as we age, our spectrum of the disorder changes. And then you also end up with some mixed incontinence where patients will have a cough, sneeze, leak, but then they also will have a gotta go, can't quite make it in time leak.
And we've all seen the advertisements of people, you know, for medications or all different kinds of products that people have got to go, you know. That's the a common experience, I guess.
It is.
And that qualifies for incontinence?
It is. So you may have an urgency frequency where you feel like you're in the bathroom every hour or every 30 minutes and you can't quite empty well. You're always having the sensation that you're full or that you have that sensation you need to go empty, even if you go and there's not much there. That's called urgency frequency. And then that may progress on to urge incontinence, or patients may just present with urge incontinence. That's where you have the urge to go and you start leaking before you want to get to or before you get to the bathroom.
Right, right. And there are certain things that women can do at home that can make this problem, you know, there are things you can do at home to prevent, but also to try and treat. Talk a little bit about the things that we should not be doing and some of the things that we could be doing to improve the continence situation.
Well, first, we don't want to get in the situation in the first place. You're right. So if it's a true anatomy problem, there's really not much that we can do to fix that other than strengthening our pelvic floor. If you've had a bad tear or you actually have some prolapse where things are starting to fall down quite a bit, then that's an anatomy problem that needs to be fixed. But certainly strengthening your pelvic floor by doing your Kegel exercises can help with that, and then weight loss also may help with that if you're an obese patient. But for the urgency frequency, there are a few things that we do at home that set this problem up for something that's going to happen to us. And one of those is, as busy mothers, we have toddlers, we're worried they might set the house on fire. So women tend to run to the bathroom as often as they get a break and empty, even if they don't necessarily have to. So they're straining to empty. They're teaching their bladder to get lazy, is what I call it, and using their abdominal muscles to empty. But they're also doing things like not doing their Kegel exercises because they have no time, or they're pushing, they're straining, or they're going very often, and they're teaching the bladder that they don't need to get that full. You need the sensation to go. So you go, and your bladder capacity will actually shrink over time. So instead of being able to hold it for 3 to 4 hours, now really you can't hold it anymore more than an hour. So you become that problem that you created in the first place.
Yeah.
Other things that we do is women are more likely to be constipated than men, and constipation really irritates the bladder. If we don't drink enough water, really concentrated urine will irritate the bladder. And then other things like medications that we may already be on for other conditions can irritate it, as well as uncontrolled diabetes, or if you've had any sort of neurologic injury, herniated disc, stroke, Parkinson's, MS. So there are other medical problems that can set us up for this.
You talked about one thing, and I know you had given a lecture not too long ago, and one of my colleagues came back and said, oh my gosh, you're never going to realize that you should not push when you go.
Right.
Like, and I know that's something that, oh, I got to quick, I don't have 5 minutes, I got to go. And what are you doing? What is the problem with that?
Well, you're using your abdominal muscles and you're straining, but you're not letting the bladder function. The bladder's one big muscle, just like the stomach, and it expands, and it's supposed to hold urine when we need it to hold it, and then it's supposed to contract and squeeze and empty when we need it to do that. And you can control some of that, obviously, or we wouldn't be in the bathroom when we are. But when we get to the bathroom, we need to then let the bladder do the work instead of the tummy muscles doing all the work. We don't want to strain because the bladder gets lazy, but also the constant straining, if you have any weakness in your pelvic floor, can get worse. So you may end up increasing your risk for stress incontinence from a moving urethra or prolapse from a falling bladder.
So lots of different issues, and so the bottom line is kind of take your time,
Right.
Don't be rushed, and going when you don't have to go is not a good idea.
No. In fact, you will end up getting into the habit where there are triggers that will teach your bladder that it's okay to go now even though you don't want to. For instance, going in the shower teaches your bladder that the water running is a trigger, so now when you wash your dishes, you have to interrupt washing dishes to run to the bathroom. If you are on a trip and you see the sign for the restroom on the side of the road, we're always telling the husband to veer off because there's a bathroom, because we just got the trigger to go, even if before we were perfectly fine. So the bladder learns the triggers that we're teaching it. So eliminating those things and really treating your bladder better is a great idea. And then also some of the things that we're doing, like with caffeine intake, alcohol intake, chronic dehydration, all those we can also address ourselves and keep our bladder healthy.
Yeah. And so obviously there's things you can do at home, and these are things that even if you don't have an incontinence issue, this is just preventative type of things. Are there certain things that you should be doing at home if you have an incontinence diagnosis? Are there some tricks and things you should be thinking about?
Well, even just like you said, normal good bladder and pelvic health would be doing your Kegel exercises. So if you have had your recent GYN or postpartum visit, or just in general having your annual, always ask your doctor if you're doing your Kegels correctly. I check on all my patients. And if you're not even doing them correctly at all, I could tell you every day, go home and do your exercises. But if they're not correct, you're not helping yourself. So for those patients, I actually will send them to physical therapy. But if you're one of those people that's doing them correctly, then I tell you, go home and do them 10 times a day or more, depending on your weakness. And you want to hold it for about 4 to 6 seconds, or even longer if you can. So most patients might be doing it on a commercial break, or when they're washing dishes or driving their car, but they're really only squeezing and letting go. You need the strength, so you have to hold it for about 4 to 6 seconds.
So the right way is to squeeze and hold, and then, and that seems to have so many other benefits, incontinence.
It does.
And,
It helps with bowel function, bladder function, it helps with sexual function, so it's very important to keep that strength, so that eventually as we do age, as our bladder becomes a little less tolerant of the volumes of urine that we've been putting in, then when you do have that urge to run to the bathroom, if you do a Kegel exercise at that time, you'll get a delay. It'll then tell your brain, I need a few more seconds before I get to the bathroom, and you won't leak.
What are some of the things that are signals for people to know, okay, it's time to go to the doctor? It's time to, what is that little mental checklist to say, I need to bring this up to my doctor now?
Well, I think if you're leaking at all, it's not a normal part of aging. You should not have a problem where if you're going to Zumba class or going running and you want to get back in shape, that you're leaking every time your foot hits the ground. It's not okay if you can't make it down the road to go shopping and you have to stop on the way to the bathroom. So any of those things are an issue that needs to be addressed with your doctor. And that can be urge frequency only, where you feel like you're emptying every hour and not even leaking. Or as you progress to any leaking at all, I think you should see your doctor, because there are fixes for it. It's not something that we should be tolerating. But if you feel like, okay, I'm going to try. Now, I've seen the webinar. I know I'm leaking a little when I go to exercise class. That's a problem for me. But it's not, I don't want a surgery. We won't jump into a surgery. You actually start your exercises and get your pelvic floor back to its correct strength.
And it sounds like there's so many things that you can try before you get to that surgery point, obviously with the guidance of your physician.
Absolutely. So you could even get normal screening through your primary care, and they can teach you the exercises or start a medication if you need it. And then by the time you see me, or even if you come as an initial visit with us, we talk about what are your medical problems that are contributing, what surgeries have you had that might increase your risk for problems, what medications are you taking that might be irritating your bladder more, and what are your dietary habits? What are you eating that's irritating your bladder? Are you using excessive amounts of iced tea or Coca-Cola or coffee that's really an irritant to the bladder? Some patients aren't affected by that at all, and others really notice a profound difference when they quit. And then we teach you the pelvic floor exercises, get you into physical therapy if you need. And the physical therapists here are fabulous. They do a great job with pelvic floor therapy, biofeedback. Sometimes they'll even use things like electrical stimulation that will teach those muscles how to strengthen correctly and how to squeeze appropriately. There's also devices on the market that we can use to retrain those pelvic floor muscles into the correct function, addressing the constipation, and then losing weight if you need to.
Yeah, I never thought about physical therapy for incontinence, but when you say it that way, it makes so much sense.
Yeah, and I have that response every single day when I tell a patient, I'm not going to give you a medicine today or a surgery, we're just going to send you for therapy. But I do notice I have them all come back at 6 or 8 weeks and they're cured. I mean, there's an 80% cure rate with just physical therapy.
Yeah, and that's great to know. I mean, you don't have to deal with the medications. We do have a question from the audience that I want to get to, and take a pause right there for just a second. Somebody wants to know if sneezing and leaking is normal. So when you sneeze, if you leak a little bit, is that a normal thing?
It is not normal.
It is not.
You should not sneeze and leak. In fact, you should never leak. If you were at the point where you could not go to the bathroom and your capacity became so large, then of course everyone is going to leak at that point. And that's not a normal situation. But just having a sneeze or a cough and then leaking is not normal. Now the issue isn't that you're not going to have a cancer happen from letting this go. So you don't have to treat a sneeze, leak. Let's say you only have allergies, once a year when the oak trees bloom.
Sure.
And you can take Zyrtec and you sneeze, once a day or 3 times a day, and you're going to wear a pad that week. Well, we don't have to jump in and do surgery for that person, or even just pelvic floor exercises would be fine. But if you come in and say, I have chronic allergies and I sneeze all the time and I'm leaking large volumes, or even constantly all day long leaking, and it really bothers me, then that's the person that we really need to see.
Yeah.
You're not going to harm yourself not treating the leakage, but you will save yourself a lot of trouble.
A lot of grief.
Right. I mean, even just buying all the incontinence pads and products for incontinence each year costs people somewhere between $750 and $900 a year.
Wow.
That's a lot of money.
It is a lot of money. And when you talk about there's so many ways that you can prevent that from occurring, the physical therapy, the things that you've talked about doing at home, it really makes a lot of sense. Talk about, as we kind of wrap things up here, talk about incontinence as a symptom for other diseases. Is it a warning sign for something else that people need to be aware of?
It is. It can be an initial sign for diabetes because the sugar is dragged out through the urine and can make you go more frequently. So you might have the urgency frequency we talked about, or even you might start leaking if it's overwhelming your bladder. And then MS sometimes initially presents with headaches and incontinence. So Usually if I see a person with new onset headaches and leaking, that's what we'll screen them for. But anything that affects the nervous system can present with incontinence. So a herniated disc might show up and have either retention or problems emptying their bladder too.
Mm-hmm. What about medications? Are there other medications that you find that are common that people are on that may cause incontinence issues?
Yes, there are actually a lot of medications that can affect the bladder, but really common ones would be beta blockers. I know our cardiologists are putting lots of people on beta blockers, which are perfectly great for especially cardio protection. It is sometimes a first line use for high blood pressure though. And in those patients, if it's possible for them to switch to either a calcium channel blocker or even strangely a diuretic, it would be better than the beta blocker. The beta blocker tends to cause people to have the urge incontinence, which is the gotta go, can't make it in time. Chronic narcotic use for some of our pain patients can make them chronically constipated, which will then make them have an urge incontinence. The diuretics certainly make you go more frequently, so if you can alter the timing of the day that you take that, that will help. Tramadol products or Ultram that people take for pain also can cause retention. A lot of the anti-inflammatories people take for arthritis can make them have swelling in their legs, so then when they lay down at night and the swelling abates and their kidneys are catching up in overtime and helping them empty. Gabapentin for some nerve system disorders can make the same thing happen. So people will come and say, I'm fine, but then at night I get up every 2 hours to go empty my bladder. So there's a lot of altering of medications if we can with the help of our primary care providers.
Do you find that it's fairly easy to make those modifications with medications?
I do. The primary care doctors we work with are fabulous, and I'll usually write a note to them and send it and say, can you please help me if this is possible to change this medicine? And if it's not, if it's something where they've had a heart attack and they have to be on a beta blocker, then we can work around that. We'll still do the physical therapy. It still works the same. And if we can't get complete relief with that, then we can then start talking about other therapies like medications or surgeries.
When you see people that come into your office and they talk about incontinence, what is the one or two things that you would want them to know about, what they can do about the situation?
Well, first, kudos to them for actually coming for it, because it's a hard topic to talk about, and even people that finally mention it to their doctors, about half of them are not really satisfied with their therapy. So I'm happy that they're in to see us in the first place. It is something that's treatable, and often with them meeting me halfway and some work on their part, it's fully curable.
Yeah. It's a good thing to know. Thank you so much
for
your expertise.
My pleasure.
That's all the time we have for today's Florida Hospital Health Chat. Of course, I want to thank Dr. Faranek for her expertise on women's health and incontinence as we've gone through this touchy topic throughout the segment today. If you would like to make an appointment and see Dr. Faranek, you can do so by calling 407-303-DOCS. You can also visit her practice website. That's www.orlandoadvancedgyn.com. There's places there where you can get more information as well as fill out a form to make an appointment. Thank you so much also for watching and participating in our chat today. It's really valuable when we have questions and input, so thank you for that. You can find out more about upcoming web chats by liking Florida Hospital on Facebook. We're going to be sure and give you updates on when we're going to have the next chat and the next topic. All the details you need will be right there. Thanks so much for joining us and have a great day.